In October of 2009, I was in a car accident, and it was virtually a head-on collision. My neck and my head, my face, my neck, took most of the impact from the airbag. And so I started having headaches. And the next day, I went to my general practitioner, and he prescribed physical therapy and some drugs, Imitrex and Vicodin and some different pain medicine. And I went through about 4 months of physical therapy, but the headaches didn't stop. The main thing was I had this pressure at the base of my skull and pain and just tension. And there was nothing I could do to get rid of that. Nothing I could do to relax it. It caused migraine headaches, and even though the Imitrex took care of the migraine headaches, there was nothing that would take care of the tension and the pressure at the base of my skull and the back of my neck. My life revolved around my headaches. I couldn't do anything. In fact, I felt like I had aged about 30 years, in overnight, because I couldn't. I was experiencing dizzy spells. I was in pain constantly. I couldn't do many of the just usual activities that I would do. I couldn't even mop a floor because I couldn't hold my head forward. The strain on my neck was just too much. I was just in constant pain 24/7. Basically, all I could do was sit around. And the worst part was I couldn't sleep. I had difficulty sleeping because to lie on my back, the pressure was in the back of my head and my neck, which was just too much. It was a very difficult, very depressing time. I'd had a conventional MRI, and it virtually showed nothing was wrong. They didn't see anything that was out of place. But when I had the upright MRI, it showed that I had some torn ligaments in my neck. It showed that my cerebellum had dropped a bit and was shifted a bit to the left side, where I was having all the pressure and pain at the base of my skull, and that my spinal fluid was somewhat obstructed. So that's where a lot of the tension and pressure was coming from as well. So the treatment was to continue to have the Atlas orthogonal treatment, using the machine to tap my Atlas back into place. And the longer that it stayed in place, then the more those muscles could relax. The procedure was so simple and so quick, and immediately, the results were immediate. I immediately felt so much better. The pressure was gone. And as the day went on, I was virtually pain-free. And it was the first time that I had experienced being pain-free in about 9 months. And I feel so much better. It's like night and day. I feel like in many ways I have my life back, because I couldn't do the simplest things. I couldn't, even just going for a walk, because my head would kind of spin, and I'd have these little dizzy spells. But when I'm in adjustment, my head's clear, there's no pain, there's no pressure. I don't feel nauseated. It's just complete. I feel like I've been let out of a prison almost, because I've had my life back. I would highly recommend image-guided Atlas orthogonal to anyone who's had any kind of neck or head trauma. It's such a simple procedure, and it actually boggles the mind that it could be such a simple procedure and the results could be so dramatic. And the results are instant and dramatic.